All right. So let's begin with ethical scenarios today. So there are certain scenarios where there are certain professional obligations, confidentiality, capacity, and contraception in minors, culturally competent. For example, LGBT groups, you have to negotiate with other people. All right. There are attendance of the patients. So these are the ethical scenarios. So before we go into the details or we discuss those scenarios, I would be discussing some ethical principles for you. I hope that you people might be knowing these four principles of ethics because these have been taught in the medical schools. Uh, so let's begin. So there are four principles: principle of autonomy, beneficence, non-maleficence, and principle of justice. All right. So what do these principles mean? Let's go into the details and then we will be discussing the scenarios so that you should be having an idea that what part of those scenarios are we going to cover, what aspects are we going to look into. Okay, so autonomy. What does this mean? Principle of autonomy. It means that the patient has the right to choose in terms of treatment options and investigations. Okay, doctor is just an advisor. Patient is the one who has the right to decide for them whether they want to undergo a particular treatment or particular investigation, or whether they do not want to undergo that. Okay, and it is a shared management. You cannot enforce or impose something over the patients. Okay, so this is that the autonomy means that the power of the decision or decision making lies with the patient themselves, whether they want to go for a particular treatment or not. This is principle of autonomy. For example, how do we ask these questions? So let's see. We need to get you admitted and do some tests to find out that you might be having pneumonia, or you might be having this particular type of problem, or ankle sprain, or this any medical condition. You can say that, okay, so we need to get you admitted and do some tests to find out. So are you okay with that? Would it be something that you would like to undergo? Okay, so the doctor has planned, or we are planning for you to undergo an MRI scan to look to look for any injury to your back, to look for any injury to your nerves. So would it be something you would like to undergo? Okay, so you need to involve the patient, and you have to wait for the patient's choice whether they want to or they do not want. Okay, this is principle of autonomy, and it is very important. You must know, you must have those principles in your mind. Then comes the principle of beneficence, that all the decisions and actions, all the decisions and actions should be made in patient's best interest. Okay, for example, if a patient says that I want to go home, then you need to explain, you try your best to explain why the patient shouldn't go home, like we discussed in the previous scenarios, where that IV drug user wanted to go home. So you need to discuss why they shouldn't go home. Okay, you might develop complications, there are issues you'd face, so it's not advisable to go home. When the patient does have mental capacity, you take the decision on patient's behalf in when the patient doesn't have mental capacity. Okay, when the patient doesn't have mental capacity, you take the decisions that are in the patient's best interest on patient's behalf. All right, that is the principle of beneficence. And how we use it, or how we impose it, like, okay, we will not be going to operate on your father because it may cause more harm, and he may end up having complications. Okay, for example, a patient's father is having a bilateral subdural hematoma, or he has had bilateral stroke. So you tell the patient that, okay, we are not going to operate on him to remove this hematoma, because the surgery would cause him more harm than doing good for him, because the patient does not have mental capacity, and you are talking to the son. So you are the one where you take decision on patient's behalf. This is the principle of beneficence or beneficence. Okay. And then comes the principle of non-maleficence. Non-maleficence means do no harm. Okay. For example, patient has dementia and not eating well, and the family will ask for NG intubation, and but you as a doctor refuse it because you know it will do more harm, not beneficial. Doing an operation on a bilateral stroke patient might cause more harm. Somebody at the end of life, uh, with no IV lines, cannulas given to cannulas placement in those patients won't be fruitful. Okay. So we place them on palliative therapy, and we go for subcutaneous injections. Okay. And if you don't know how to do it, then don't do it. That is the principle of non-maleficence. Okay. Do no harm. Okay. And then comes the principle of justice. Justice means the principle of justice say that you need to prioritize the patients. Prioritizing the patients, for example, somebody in A&E has come with ankle sprain and waiting for 4 hours, and somebody has come to A&E 2 minutes ago, or 10 minutes ago, with shortness of breath. So the one with shortness of breath should be prioritized. Okay. They should be prioritized. And the patient who's sitting with ankle sprain, he can wait, but the patient with shortness of breath, they can't wait. So this is the principle of justice. Okay. And it happened that during the COVID, elderly were taken off from the ventilators, and younger ones were given the priority, okay, to be placed on ventilators. So we have discussed those 4 principles. You should have those principles in your mind whenever you come across ethical scenarios. And then let's move on to the 4 C's. Remember 4 C's, okay? That is confidentiality, capacity, consent, and scenarios with children. What happens because somebody asked question that how old a child should be to ask questions, to give consent, or we can ask questions from that child. How old should that child be? Okay, so I'll be answering that question as well today. So confidentiality, what is confidentiality? Confidentiality is everything that you discuss with your patient, that is between you and your patient. It is confidential. It will remain between you and your patient. It shouldn't be conveyed to anyone. Okay. And there are certain times where confidentiality can be breached, but I will tell you shortly. The thing is that sometimes you have to remind the patient. When patient comes to you, you have to remind the patient that, okay, uh, remind the patient of confidentiality, like when patient is reluctant to give you information, because we will be discussing the scenarios later on, where patient comes to you and they won't be opening up, they won't be giving you information, or might be they are lying to you, or they think that you will discuss it with someone else. You might inform their parents, or you might inform their boss or their husband. So you need to ensure confidentiality. Okay. You need to then, okay, for example, if they are afraid of someone, maybe their husband, boss, mother, so you need to ensure the patient that, okay, whatever we discuss here will remain between us and the medical team. Okay. Because you have to tell, you will not say that, okay, whatever you discuss here will remain between you and me. No, it should be between us. It will be between us and the medical team. You have to mention it, because there are certain scenarios we have to involve medical team, we have to involve the police as well, and we have to involve the concerned authorities. Okay. Child protection teams, we have to involve salvation armies in modern day slavery scenarios. Okay. In child abuse, we need to inform the police as well, we need to inform child protection team as well. So you have to tell that we will be informing the medical team, and if they need, then later on they can do this. And whenever the patient has opened to you, they have discussed everything, then at the end you can say that, okay, now we need to, it is a matter of child abuse, so we need to involve the child protection authorities as well. Okay. So this is confidentiality. Okay, let's see now. There are certain instances where you can breach the confidentiality. Okay, for example, when somebody's life is at risk, so you don't care for confidentiality, you can breach the confidentiality. You take the decision. Okay, you take the decision yourself that what should be done in this situation. And you are also allowed to breach the confidentiality when somebody has broken the ethical code, or has expressed an unprofessional behavior. For example, your colleague who has had a misconduct with a patient, or who has been harassing a patient or making a patient uncomfortable during the sessions. So you can breach the confidentiality and you can inform your consultant. You can report him to the GMC via consultant. Okay, and if he has been putting other people at lives at risk, so you can breach confidentiality in those matters where the patient's life is at risk, where somebody else's life is at risk, and when there is a gross misconduct, there is ethical code, misconduct of ethical code, there's breach of ethical code, and if there is breach of the professional boundaries, and putting others life at risk, you can breach the confidentiality. Here you take the decision. Okay, and in minors, in children, so confidentiality in minors, like for example, sexual life and private life has to be kept confidential in minors. Whenever somebody is coming to you and asking for contraception, so you need to keep that confidential unless their partner or if their partner is abusing them, or they are much older, or there is a suspicion of abusive relationship, then you can breach the confidentiality. You can inform other authorities. But if there is somebody is coming to you asking for contraception, and the partner is of the same age as the person herself is, so you can prescribe them contraception, and you cannot tell the parents, or you cannot tell police or child protection authorities. Okay, you cannot breach the confidentiality. Okay, but if the child, or if the person coming to you is under 13, then you need to inform the parents. Okay, under 13 you need to inform the parents. And children above 13, they can give consent. They understand the implication. And in UK, let me tell you, in UK, that anybody who is over 13 years of age or over 13, they are allowed to have sexual relationship as far as their partner is of the same age. Okay, so keep that in mind. It would be coming in one of the scenarios later on. We are going to discuss it. And then the rest of the age groups, 16 and 17, they can give consent for treatment and all those things. And then comes the we are done with confidentiality, and we need to go capacity. What is capacity? For example, in order to give consent and make one's own decision, patient needs mental capacity. Okay, patient needs, because if a patient is having a sound mind, then only then they can make decision for themselves, they understand what is right or wrong for them. So this is capacity. So we need to assess mental capacity of the patient for any sort, any treatment, or refusing any treatment, or any other for example, we have to discuss their medical condition where their children, or their somebody else comes, their relative comes, or their children come. For example, a son is coming and asking for her mother's notes or her mother's treatment. So first you need to ask for consent from the patient, from the mother, and then you should assess her capacity, that whether she is able to give consent or not. If she is mentally sound, then you cannot if she has capacity, she can make her own decision. You cannot disclose the information to the son. Okay, whoever that may be. We are going to discuss this scenario shortly. And how do we assess capacity? We check for 4 things in capacity. We need to check for 4 things. Number 1, whatever you are going to tell the patient or discuss with the patient should be able to understand. Okay, the patient must be able to understand the doctors, the nurses, the staffs information. Okay, the practitioners information, what information they are going to give, the patient should be able to understand. Number one is understanding. Number two is they should be able to retain this information. The information that you have given to the patient should be able to retain that information in their mind for a reasonable period of time. Number three, we have discussed to understand, retain information. And number three is the patient should be able to contemplate, meaning that they should think deeply over it. Okay, for a certain period of time, they should think over it. They should give time. They should give thought to it over a period of time, that okay, and make an informed decision. Okay, whether I can take warfarin, what would be the complications of, what would be the side effects if I'm going to take warfarin, what would be the complication if I do not take warfarin. Okay, so patient must understand, must retain, and must contemplate, that is, think over it. Patient must think over it. And the fourth thing is that the patient should be able to communicate with you, communicate it back to you, that okay doctor, I want this treatment, so what are the advantages of this treatment. And they should tell you, they should be able to tell you that okay, what they understand about their treatment and what disease do they have. Okay, if the patient refuses the treatment, first thing to check is whether they have the mental capacity or not. Okay, you have to ask for four things: that the patient should understand, the patient must retain that information, the patient must think over it deeply, and the patient must be able to communicate it back to you. That is capacity. You have to check four things to assess mental capacity. And if the patient doesn't have mental capacity, then you need to go for discussion with the family. For example, a dementia patient develops cancer. So dementia is because dementia is a progressive mental disorder in which patient's personality deteriorates and he becomes more forgetful over the period of time. So what you need to do, he has mental capacity. There are certain good days, certain bad days. He has the mental capacity. If the patient has mental capacity, then you need to take patient's consent for their treatment. It doesn't mean that he has dementia and he is lacking capacity. Okay, do not get confused with it. Patient with dementia can have capacity and they can give consent for their treatment. But if the patient does not have capacity, then you need to you need to involve their family. All right. And then the next thing is consent. Consent is very important. Consent, you need to take consent for everything. It's just not that you are looking at a patient's eyes or face. It means that you are examining him, or just you are looking at them and you are examining it. You can examine them. No, they are if it's their face or their eyes are exposed and you can examine him. You have the right. No, you have to take consent even if you are going to examine the eyes, or you have to look at the face. You need to tell the patient that okay, I would like to examine your face, your mouth, your tummy. Would that be okay with you? Okay, so to speak to the patient, if he has the mental capacity, you need to take consent. Okay, to speak to the patient. And then if they don't have mental capacity, then speak to the family. If patient has the capacity and relatives want to know more, okay, there are certain scenarios that the patient has got the mental capacity, but the relatives or the family wants to know more about the patient's treatment. In that case, you can speak to the relatives and you can collect information from them. You can just collect information, but you don't give any information in that case because you have not taken consent from the patient. So you can talk to the relatives. It is not that you won't completely and not talk to the patient's relatives. No, you can talk to them, but you won't give them any information. You won't take you won't give them any information about the patient. You would just take information from them. Okay, I hope I'm not confusing you. So as I mentioned, that for the purpose of examination, for talking to the patient, you don't need to take consent, but for examination, you need to take consent from the patient. For example, I need to have a look at your mouth, your eyes, or your tummy. Would that be okay with you? Okay. So let's discuss the fourth C, that is children. So children above 13 can give consent. Parents can't refuse treatment. Okay, if a child is willing for a treatment, the parents can't refuse that treatment. Children always belong to the state. Remember that, okay? And doctor needs to make decisions. If mother refuses antibiotic treatment for a child, for example, you need to sit them down and talk to them without any conflicts. But if they are still refusing, if they do not agree, then you need to take the decision for the child's best interest. Okay, you will be the one who will be taking decisions for them, right? So parents do not have the autonomy to make decisions for the children, okay, for a child, because I told you that children belong to the state. No need to tell the parents everything, only tell if in favor of the child. Okay, if it's in the favor of the child, you can tell the patient, so patient's mother or the child's mother. No need to tell everything, because the children belong to state. And if it's in the best interest of the child, you can make decision on your own, on patient's behalf, on or child's behalf. Okay, let's discuss the scenarios. Is it clear so far? So let's go with our first scenario, that is professional obligations. Ankle sprain. Okay, so you are FY2 doctor in emergency department, Mrs. Alice Jones, who has come to the hospital with an ankle injury. She fell down at home after stepping on wet grass. Okay, she fell at home. You have seen Alice Jones 30 minutes ago and examined her. She has bruising, swelling, and tenderness on the left malleolus. That suggests some sort of ankle sprain. Okay, you sent her for ankle X-ray. She is now back from an X-ray department. Discuss X-ray findings with her and address her concerns and discuss management with the patient. So this is the scenario where the patient has come to you after she fell at home, and you examined her and sent for X-ray, and after that she came, and now she is here. She has some, you are going to discuss some management options, and she has some concerns. Basically, she is here, she wants you to change her notes, because she wants her solicitor has advised her to change her notes so that she can get some benefit. Okay, she can get some leave, paid leave from the work, and she can get some compensation for it. Okay, so that is all she needs, she wants you to do. So let's see how we can tackle it. Okay, so how you approach, you will be approaching with grips, because you have already seen the patient do it, like you have sent the patient for real, that okay, all right, good, nice to see you again. So you are Miss Alice, I remember I just sent you for an X-ray. So is X-ray, I hope you have done the X-rays. So let me have a look at your X-rays, please have a seat, let me have a look at your X-rays. And then pretend to look at X-rays. The examiner might give you X-ray straight away. Okay, here is the X-ray, and then you can see, you can say, okay, all right, pretend looking at the X-ray, say, okay, two bones, all right, here, heel bone and bones in your toes, they are normal. Okay, there's no fracture. From what you have told me, that you fell down and you had some swelling and pain. After looking at your X-rays, and from what you have told me, you have a condition called ankle sprain, and which is a condition caused by overstretching of ligaments around your ankle. Okay, and it is a soft tissue injury. It takes a reasonable time for healing, so you need to be patient. Okay, and you need to be patient for it. You have told the diagnosis to the patient, and then you discuss the management with the patient. That I already discussed with you, that the management is price, that is prescribe painkillers. Before prescribe painkillers, you need to ask for allergies as well. You can ask allergies, and then uh, rest of, or you can offer crutches to avoid further damage to the ligaments. Okay, and then ice apply it for 15 to 30 minutes. Do not apply for less than 15 minutes or more than 30 minutes, because it would cause more pain. Okay, less than 15 minutes won't be effective, and more than 30 minutes would cause you pain. Okay, and then compression, you can ask for compression bandage to support the sprain, to support the ankle. Okay, and elevation. Whenever the patient is sitting, ask her to elevate, keep her limb of leg elevated. Okay, and then you need to tell the patient that, okay, I have reviewed your x-rays, I have already seen your x-rays, but your x-rays will also be reviewed by the specialist. If there is anything we have missed, or there is significant, anything that is significant in x-rays, you will be informed about it. Okay, you have to tell the patient and ask for any concerns. When you will be asking for any concern, then the patient might tell you that, doctor, can you please do me a favor? You will explore, okay, what you want me to do. The patient would say that, doctor, actually I didn't fell at home over the grass, I fell at work. So uh, can then you will be asking, okay, earlier you told me that you fell at home, and now you told me that you fell at work. So could you please tell me, why are you saying that? So she would be telling you that, my solicitor told me that if I have a note saying accident at work, I might get some compensation. Okay, so the doctor, you as a doctor, you will be replying that, unfortunately I won't be able to help you in that way, because I'm not allowed to make any changes. I can't do something like that. Okay, I won't be able to make changes to your notes. I am bounded by my professional boundaries. She won't be asking you that, why are you not going to change it? Then you tell that, because we don't do that. It is wrong for a doctor to write false information, anything that has not happened. So unfortunately, I cannot help you in this way or the way you want. So the patient might get sentimental, or she might say, okay, doctor, I'm a single mom and I'm on 0 hour contract. If I don't work, I won't get money. And then you can use Eve protocol over here, because she's firing with emotions. You need to fire back with Eve protocol. Okay, so as a doctor, you will be saying that, okay, I can understand that you are worried, and I understand the financial implications. Okay, and I'm afraid for I'm sorry for your situation. What you can do, what you can do here is, you can speak to the job center, or that is Citizen Advisory Bureau. They might give you some advice, and you may be entitled to child benefits. Advise her to Also, you need to advise her to speak to her employers, because her employers might understand. You can tell that, okay, you can speak to your employers, and they might understand your situation, and they might give you some uh, compensation. Okay, and they may give you paid leave as well. Okay, they can compensate you, or they can help you sometimes in a compassionate manner. Okay, unfortunately, I can't help you with I can't help you in the way that you want. And the patient will be not convinced until the end. She might say that, okay, doctor, can I speak to your seniors? And then you have to tell, unfortunately, neither me nor my senior can help you in the way that you want. I'm really sorry. Is there anything else I can do for you? Okay, you need to say that. And then patient might ask you for having a look at her notes. And can I read my notes, doctor? Can I have a look at them, because I might need them later? And you should reply that uh, you won't be allowing them. Okay, you don't have to allow them, because there is a proper procedure for it, where if somebody wants their notes, they go to hospital information center, where there's a record keeping department, where they have to submit a little fee, and they can get a copy of their notes. Okay, so you should reply that, okay, at the moment, I can't allow you to have a look at your notes. If you want a copy, or if you want to have your notes, what you need to do is, you need to go to the hospital record or in record keeping department, where they will be asking you for little fee for notes, and then they can provide you with a copy of it. Okay. Mm, you should refuse them politely. Okay, and then say no with a smiling, friendly face. Okay. And sometimes you might get a scenario. This was ankle sprain. Sometimes wrist sprain might be given to you. Okay. So this is a scenario where you come across a patient that where you have to maintain your professional boundaries, because if you are going to write a false information, if found, then the consequences are going to be very bad. Okay. So another scenario, where's the next one? Okay, there's another patient who has come to you where this is a scenario which I was talking about, that you can breach confidentiality in certain scenarios. Here you can breach the confidentiality because this is the case of misconduct, unprofessional attitude. Okay. Putting somebody down, or harassing. It is a case of harassment as well. You can see having sexual relationship. It is against the ethics. Okay, for a doctor or for a teacher to be in relation with her with his student. Okay, so for a doctor with his or her patient. Okay, a doctor can have a relationship with the patient, but after 3 years of discharging that patient. Okay, medical patients. And keep that in mind, that he can have relation with a patient after 3 years the patient has been discharged, and he or she is not under their treatment or their care. Okay, so but this is not for the psychiatrist patient. A doctor can never have a relation with psychiatric patient. Okay, it is not allowed. They can only have a patient with a relation with medical patients, but after 3 years of medical treatment, after 3 years have been completed, the patient received that treatment 3 years ago, and 3 years have been completed, and the patient is no more your treatment, no more your patient for the last 3 years. So uh, you can have relationship with that patient. You are allowed, but never for the psychiatric patients. Keep that in mind. Okay. And this is a case of psychiatric patient who is a patient with depression. Let's discuss it. Sexual relationship with a doctor. FY2 in GP surgery, a 30 years old lady made an appointment to see you, talk to the patient and address her concerns. Other information is that about the patient, you have that her husband passed away 3 years ago. She has depression. She's on serotonin, but for the last 1 year, she hasn't been taking that medication, but she followed up with her community psychiatrist. There could be another scenario where a psychologist may be there. Here in this scenario, there is psychiatrist. The psychologist could be there in other scenario. Okay, same approach, same questions, and same methodology will be used. Okay, so let's see how we approach this scenario. So after you enter the cubicle, do grips, greet, repo, introduce, paraphrase, or purpose of consultation, state the purpose of consultation, smiling face, and then the patient will be telling you that, okay, can you will be asking, okay, how may I help you today? The patient might say, the doctor, can I change my counselor, or I'm here to change my counselor today. So then you need to explain, okay, can I, may I know why you want to change the counselor? Okay, can I ask you why you want to change your counselor? So the patient would be saying, doctor, I'm not sure whether I should disclose this to you, or whether I should share this information with you, whether if I tell you this information, will it be between you and me, or will you tell it to someone else? So here you will be ensuring confidentiality. Okay, uh, you will be telling, okay, sometimes some patients do come to us and they ask for changing their counselor. It happens usually if they are not happy with their services. So can you tell me what happened, and why do you want to change your counselor? And let me tell you that whatever we discuss here will remain between us and the medical team. Okay, that will remain confidential. Do not say confidential. You can say it. There are ways of saying it. You can say that whatever we discuss here will remain between us and the medical team. It is a way of ensuring confidentiality. You cannot say that, okay, whatever we discuss here will remain confidential. No, you should explain it to the patient that, okay, whatever we discuss here will remain between us and the medical team. It is examiner has got that. Okay, you have explained nicely to the patient that it is confidential. Okay. So after that, the patient might open up, or sometimes the patient might not open up to you. She might be telling you, she might say that, oh no, doctor, because I got this scenario. I got this scenario in mock stations. So she was a female patient, the same patient. So she said that I just want a change of a counselor. I said, why? And then she said, doc, just for a change, I want to have a female counselor. And she was not opening up. She was taking a lot of time to open up. And I offered her confidentiality soon after, because she has been taking me, she was derailing me, she was detracking me. So I offered confidentiality twice. Okay, twice. I offered her in the beginning, and later I offered her confidentiality again. And then she opened up and she told me everything. And she will be asking you then, after you ensure the confidentiality, the patient might tell you, okay, doctor, I've seen him with another lady. So you are going to ask that, okay, tell me, how has this affected you? How has this affected you? Has this any impact on your life? Okay. So uh, she will be telling you, doctor, actually we had a relationship. And then you will be asking, okay, can you tell me what sort of relationship did you have? How did it start? How long did you have? Okay. And then she will tell you, doctor, it started like he became more friendly, then he started touching me. And because my husband died, so I wanted somebody to be my side. So initially it felt good. It started with hugging, and then he started with putting his arm around me, then hugging, and then kissing. Even we had like we proceeded to kissing as well. Okay. And then you should be what you should be doing, you should be non-judgmental over here. You should be listening actively. Here is the tip. Okay, listen actively, be non-judgmental, be very empathetic, and raise your eyebrows and nod your head as she's saying, and set your tone as well. Okay, and keep nodding your head. Okay. Mm-hmm. All right. Mm-hmm. Mm-hmm. Okay, this should be the way you should be listening to the patient, active listening, and you should be non-judgmental. And then what the patient has told you this information, you need to dig out more information from the patient. Okay, whether they had a sexual relationship or not. So you will be, okay, I would like to ask you a few more questions about it. Can you tell me what is the name of the doctor? How long has this been happening? Have you started seeing him outside the practice as well? How often did you meet him? How was your relationship? Was it okay? And has he ever expressed any sort of abusive behavior, including verbal, psychological, physical, or sexual abuse? Has he ever said things to make you feel down? And has he ever abused you emotionally? Any physical abuse, any sexual abuse? You need to ask about it. Okay. And then you will be asking about sexual relationship. Okay. Did you have any sexual relationship with him? The patient might say no or yes. Okay, the reply, the patient, it depends on the patient. The patient might say no. And uh, you need to ask more. Has he ever abused you sexually, harassing you to have sexual relationship? Has he ever made you uncomfortable during the session? Has he ever threatened you to threaten you with anything? Okay, like exposing you, or threatening you or abusing you financially. Okay, asking for any money, or like any sort of thing, like, okay, then you need to use that eve protocol over here. And I can see, as a doctor you will say, I can see that this has an impact on you. I completely understand why you want to change your counselor. I'm really sorry for what Dr. Smith has done to you. Okay, this should be your tone. And then you need to ask about her depression, because she's already a patient of depression. You need to ask, okay, how is your depression now? Do you feel low? Do you think that your symptoms have relapsed? Your symptoms have come back, okay, after what has happened? Do you think that you have a relapse of symptoms? How long have you been diagnosed with depression? What treatment are you on? You need to ask all those things, okay. And you can take medication allergy and past medical history as well, all right. And then you need to ask that after all that happened, how do you feel now? What are your thoughts? Then after you have done with it, then you can say, as you have requested, we can look into a female counselor, and we will be in touch with you in this regard, okay. And the patient might be insisting on the female counselor. Then you will be asking that, okay, would you say that you have lost interest in all the male doctors? You will ask that question as well. The patient might say yes or no to it. And then you will be telling that whatever Mr. Smith or whatever my colleague has done to you is wrong. And let me tell you that mm, let me tell you that it is not allowed. It is what my colleague has done. It is a gross misconduct. And as a doctor, we are not allowed to have sexual or romantic relationship with our patients, and it is wrong. We always have to maintain our professional boundaries. Having an inappropriate conversation, all these things are considered as a gross misconduct, and it needs to be reported. And for that, I need to speak to my seniors. Okay. This is a point where patient might tell you that, okay, doctor, I don't want to get him in trouble. I don't want to report him. But as a doctor, what you will be doing, you will be telling that, okay, I understand that you do not want to get him into trouble. But when a doctor becomes aware that their colleague is involved in such a thing, we are bound to inform this. We are bound to report this to the authorities. It is not something that I can let go of. We also need to check whether besides you, has he been involved, or has any other patient been affected? Has he been involved with any other patients before you? Okay, so we need to look into it. And you also do not have to worry. Your information will not be disclosed, and it will be confidential. They won't be bothering you, okay. And we need to make sure that nobody else is in the similar situation. And then at the end you can say anything else, and you can appreciate her that when she opens up, she told you, you can appreciate her that I appreciate that you came forward, and you have discussed everything me, you told me. And you can appreciate her step, okay. So it will be a part of your IPS. Appreciating her will be a part of your IPS, that okay, you have made the decision, you have made a step forward, and you have told us about this misconduct. Thank you. Thank her, okay. And anything else I can do for you, okay. And then let's move on to the next scenario. Third scenario is whiplash malingering. It is similar, very similar to the first one. Here the patient is, you are FY2 in GP surgery. A 35 years old lady has presented with some concerns. 2 weeks ago, she had an RTA. She was taken to the hospital, examined, and all the examination was normal. Talk to the patient and address her concerns. Okay. So this patient had RTA 2 weeks ago, and while she was driving a car, and she hit a tree. And it was evening when she was drunk, and she was driving after drinking, and she hit a tree. And what happened is that she got tested for alcohol, and she got positive, and she received a ticket for it. And she has been forbidden from driving, okay. and she has been banned for 3 years. So the patient herself is a medical representative, and she is going to lose her job because she has to go far away and she has to visit a hospital on daily basis. So she is here today. So she has come and she's telling you that, okay, I want you to write, to change my notes, that I had. She is malingering that, okay, I have this whiplash injury. Okay, you know what is a whiplash injury? It is sometimes, what whiplash injury is, when somebody is in a moving vehicle and it suddenly hits, and the person suddenly accelerates and then decelerates. It is like to and fro motion of the neck. The patient moves suddenly, the head moves forward and then backward. This is like moving forward and then backward. So it causes injury to the spinal cord, to this, particularly to the cervical vertebrae. Okay, so it can be involved. If it is whiplash injury, so it can cause injury to the spinal cord, and the patient may have problems breathing, and problem with sensations and motor problems below the neck. All right, so this is a whiplash injury. So she is saying that you should write that I have that injury. I'm having that injury. I still have symptoms. She has come because she is a medical representative and she knows a bit about whiplash. What is whiplash? So she has come. She is malingering. Basically, she doesn't have those symptoms and she is just pretending to get some benefit because she has been banned from driving for 3 years. So what you need to do is do grips. Approach to the scenario is do grips, and say, how can I help you today? And then that she would be saying that, doctor, can you give me a medical note saying I have whiplash injury? Then you have to say that, okay, let me have it, let me check, or let me see, how can I help you with that. But before I need to ask, before that I need to ask you few questions. Is that okay with you? Okay, then basically you need to take the incident history, start taking history of the incident. Can you tell me what happened? What sort of accident did you have? When did it happen? What caused the accident? And what happened after the accident? Ask for any head injuries, and did you bang your head into anything? Any vomiting danger signs? There are certain danger signs. Ask for any vomiting, any loss of consciousness, any bleed from ear, nose, or throat. Okay, any ENT bleeding or any fits. Okay, any neck pain, any neck stiffness, or any pain at that time and pain now. Okay, and how is she doing now? And then you take medications history, allergy history, and allergy medication and past medical history as well. Okay, and here you need to ask about occupation. Very important here, because I have told you that the patient is medical representative, and that's why she has come and she knows something about, she has some knowledge about whiplash. So that's why she has come to ask you to write it. And because her job is that it demands going from one hospital to another on daily basis, so she needs to drive the car. That's why she wants you to write or change her notes. Okay, and then uh, so you ask the reason that why do you need to write, or why do you want me to write it, that you have a whiplash injury? Can you can't your employers, you need to ask about it. And then she will tell you, doctor, I am a medical representative, and she might tell you the whole story about it. Okay, and then what you do is you will be doing the examinations. Okay, you will be doing the examination after you have asked this question, you have taken the history. Basically do the examinations to double check that she does not have any problem, or that she does not have that injury now. Okay, and then examiner will be giving you the findings and then tell, okay, I have examined you and everything is normal. Unfortunately, I cannot help you in the way you want. As a doctor, I have a professional duty to be honest So at the moment you don't have a whiplash injury. That's good, and I'm really sorry. I cannot help you, and I cannot give you a note saying that you have whiplash injury. Okay. So the patient might have some concerns like saying she might get emotional, doctor, I'm a mother or I'm a single mother and I have two children. I'm the only breadwinner. I lose my job. And then again comes the Eve protocol. She's firing with emotions, fire back with Eve protocol. So I'm sorry to hear about your situation. What you can do is speak to your employers. They might help you, or they might give you a different job role, or you can speak to job center, that is a citizen advisory bureau. Okay. And again, the same question that can you speak to your seniors? You are just a junior doctor. Okay, you're just a junior doctor. Can you speak to your seniors? The same, you should reply the same, that okay, I'm sorry, unfortunately neither me nor my seniors can help you in the way you want, because you do not have whiplash injury. Okay, we are doctors and we are bounded by professional boundaries, so we are not authorized and we are not allowed to write any false information in a note. Okay, these are the professional obligation scenarios. Any questions so far? Any questions? So we've already discussed about confidentiality, that whenever somebody comes to you, for example, a son is asking about his father, or a father is asking about his daughter, or a son is asking about his mother. So you need to keep the patient information confidential. You can just gather information from them because the patient hasn't given you any consent. Unless the scenario states that consent given, you will assume, you must keep in mind, this is a tip, you must keep in mind that no consent has been given. Scenario would state that okay, consent has been given to speak to the relative, to the father, to the son, to the daughter. Okay, so unless mentioned, assume that no consent has been taken, and you won't be disclosing any information. Rather, you can dig out information from the relatives, but you don't need to give information. You won't be giving information. You have to keep the patient information confidential. Okay, let's discuss a scenario, an interesting scenario. Concerned parents. Here, a mother has come to you about her daughter after finding contraceptive pills in her room, who is okay. So you are FY2 in GP. Miss Leslie Brown, a 50-year-old lady, has come with some concerns. Miss Leslie Brown and her husband, Mr. Brown, and their daughter, Emma Brown, all are registered patients in your GP practice for the last 15 years. Miss Leslie Brown has come with some concerns. Please talk to her and address her concerns. Okay, so let's see. So you have got a special note here that you have not seen Emma or any of her relatives for the past 15 years. So this is a mother who has come to you after she has found the contraceptive pills in her daughter's room, and she has had some conversation with her daughter, but daughter told her that the pills do not belong to her, and it's her friends. So the mother didn't believe her, and she has come to the GP practice to ask for the daughter's notes, that has she been prescribed with this pill. Okay, so let's see what are the concerns of the mother. Okay, so you will be introducing the same approach, following the same approach. Start with grips, introduce yourself and ask, okay, is it Miss Leslie Brown? If it's written outside the cubicle, better you can ask and confirm the name, or you can say that, okay, could you please tell me, may I have your name? Okay, both, if both parents are there, then introduce yourself to both parents and then ask their names. And then you can say, okay, how may I help you? Be extremely friendly to them. Okay, and the mom might tell you that, doctor, I'm wondering whether my daughter Emma has been to this practice. earlier. So you will be asking, may I know how old is your daughter? And what is the name of your daughter? Ask the details of the daughter to confirm that, okay, which patient or which patient the mother is talking about. Okay. So then and doctor mother will say that she is 15 years old, and then you need to ask that, okay, can I ask you, why are you inquiring whether your daughter has been here or not? And then she might reply, actually yesterday I was cleaning her room and I found some contraceptive pills under her bed, so I think she must have gotten it from one of the doctors here. This is the mother's concern. And doctor would say that, did you ask Emma about these pills? uh, Mom would say, I did ask. She told me this was her friend Sarah's. She got very angry and she slammed the door. After that, she didn't talk to me. And then you will be replying, oh, I see that. I see. I can understand that you are a bit concerned. I understand why you are concerned. Any mother in your place would have been concerned about their young teenagers and contraceptions. Okay. But unfortunately, I won't be able to give you any information about Emma without her consent. You need to mention it. As I have not spoken to Emma, so I am unable to give you any information about her. She has not given any consent. So I won't be giving you any information. I'm really sorry for this, because we have to keep all our patients' information confidential, and we cannot disclose anything to any person without the patient's consent. You have to say that. I hope you understand. However, the mother will be really worried, and she might be anxious, and she might say that, okay, doctor, I am very much concerned about her. I want to know that might be my daughter is doing something wrong. And then you can say that, okay, to your worry, what I can do is I can do you a favor. What I can do is I can explain to you that when somebody at Emma's age or a younger person comes to the practice and asks for contraception, what we or what a doctor normally does. Okay. So you have to tell that what do they do. You will be giving a general idea that, okay, what a doctor does when a young young female comes, asks for contraception, what they do. Okay, but you won't be telling any information. You won't be giving any information about Emma. You won't be talking particularly about Emma. You will be giving general information. You can give general information to relieve her worry. Okay, so you will be telling that, okay, let me tell you, the very first thing that what we do is we persuade the young ones to come with their parents and inform their parents of their relationship and involve them. And most of the time the young one they refuse, because they are afraid of their parents, that their parents would get angry. So they do not tell their parents. Okay. And ask for contraception. And we also check that whether they are they we also check their suitability for contraception. Okay, whether we need to prescribe contraception to them or not. And we also check something we call as Fraser criteria and Galix competency. We will be discussing it shortly, but you can tell them that, okay, we will be discussing, we ask something we call as Galix competency. We assess that the young one knows what are why they have the capacity, why do they need contraception, what happens if they do not need contraception, do they know some of the risks of being in a sexual relationship and using contraceptions. Okay, what happens if they do not use contraception. So we assess it, and then if we see if it is in the best interest of the young one or the teenager, then we prescribe contraception. And if we also tell them to inform their parents about it. And most of the time they because of the fear that their parents won't understand, they become angry, they don't tell their parents. And the next thing is the mother will say that, doctor, I'm worried that she might be going out with someone older than her. Do you do anything about it as well? And then you will be telling, yes, I can understand your worry. Let me tell you that we do check who their partner is, what is the age of their partner, and are they in any form of abusive relationship. And if we find any sort of abusive relationship, then we inform the concerned authorities, such as child protection authorities. We inform the parents as well, and also we inform the police as well. Okay, you need to tell all those things. And mom might ask you that, doctor, I'm worried about sexually transmitted infections. And then you would say that, yeah, well, that can be a concern. I clearly understand. We always advise them to practice safe sex whenever possible and go for screening for STIs. And mom would say that, doctor, I think it's illegal for Emma's age to be involved in sexual activity. I've already told you before that in the UK, it is not illegal for someone who is above 13 to be involved in sexual activity unless their partner has got the same maturity or they are of the same age. They may be 1 or 2 years older, doesn't matter, okay? But they shouldn't be much older, like 10 years or 15 years or 7 years. So there shouldn't be much age gap between them. So mom would say that, doctor, we are Roman Catholics. It's against our religious beliefs to be in a sexual relationship before marriage. What can you do about it as a doctor? So you should reply that, well, Mrs. Brown, we have very little control over religious beliefs as a doctors. So we won't do anything and we won't give any advice regarding religious beliefs. It's up to the parents and their children. We don't get involved in that. Okay. So we don't give any advice over religious beliefs. And the mom might ask you another strange question that, okay, doctor, what would you do if Emma were your daughter? So what would you do? Then you have to be calm. Okay. So although I think some people, some doctors might find that, okay, it might be a question that might offend you, but you can reply it politely that, okay, if any parent wanted to have a difficult discussion or this sort of discussion, sensitive discussion with their daughter, so the first thing is to have very good relationship between parents and the children. And if relationship is good, if you have good communication with your children, then you should be able to conversate with children. And what you can do is I would take my daughter for camping, take her for uh, dinner or lunch, and then I would have discussed it with her. Okay. And then at the end, you can say that, is there anyone else in the family close to Emma who can discuss this with Emma or ask Emma? And I would suggest you that you should talk to Emma when she is calm. You can talk to her at some other time. It is something that you can ask from her. Okay. You can ask any relative or anyone who is close to Emma. They can inquire it from Emma. So this is the solution for it. And at the end, you will say that, okay, Mrs. Brown, I can understand that I have not been very helpful today. I'm really sorry. My hands are tired. And is there anything else I can do for you today? That's all. Okay. So this is the way you have to uh, reply, or you have to respond. You have to deal with this parents. Again, another same scenario. Here is a concerned parent about depressed child. A daughter, she is not in contact with her father, and father is worried about her. The daughter lives far away. She has recently she had divorced. She had left her job as well, and she lives far away. And father has not been in contact. and he has contacted the relatives or the neighbors where she used to live, but they say that her house is locked. So the father is really worried, and he has called you to inquire about her. Okay. So the same approach here, you will be following the telephonic approach. It's a you are FY2 in GP surgery. 64-year-old man has called the GP practice concerned about his daughter. Talk to him, address his concern. Telephonic consultation. So it is a telephonic consultation. So you will be starting it like this similar that okay, hello, who is it speaking? May I confirm your name and date of birth, please? And after that, you have confirmed it, you will tell, okay, I'm Dr. Emma, one of the doctors speaking from GP surgery. Okay, could you please confirm your first line of address for me? Is it the same number? I can call you back on if the line gets disconnected. Okay, can you please tell me how may I help you today? So the patient would start asking you, okay, the attendant or the father will ask you, okay, doctor, I actually have called to ask about my daughter. Then you will confirm the details of the daughter that, okay, uh, can you tell me what's the name and what's the age of what's the date of birth? To be more specific, you can ask about the date of birth. Age, sometimes people might guess, they can guess, but if you will be asking date of birth, then only the parents would know that okay, she was born on this date of this year, and they would respond on it's a way of confirmation. Okay. So you will be asking that, and then you will be asking that, okay, how can I help you today? And then he will be telling you, doctor, I want to ask about my daughter. And then you will be you will start to take history. Start taking the history, and you will be asking, when did you see your daughter last time? Do you know where does she live? Did you try to call her? When did you last talk to her? And why are you worried about her? Why are you worried about her? Any particular reason? And okay, and how often do you talk to her? You need to ask all those questions. Okay. And then the father will be telling you that I am particularly worried about my daughter because she is having depression, and she might do something wrong. And then start taking history of depression. That okay, when was she diagnosed with depression? Do you know what medication is she on? What do you know so far about her present condition? And has she had some stress in life? What are you worried about? Are you worried that she can do something wrong? Has she ever tried to harm herself? You need to explore the worries. If the patient is not telling you, you need to, if the father is not telling you, basically he's not the patient, he's the father. So you need to explore the worries, okay? And then ask about social contacts, that okay, who does your daughter live with? Is she in a relationship? Does she have any children? And then you have to ask about father's social life, that okay, what do you do for a living? Who do you live with? Is her mother around? Is it possible that she could be in contact with any relative? Have you contacted them? Okay. And then uh, ask him that okay, how do you think I can help you with this? He will be asking, doctor, can you please give me some information about my daughter? Has she recently been to your practice? So you will be saying, unfortunately, I won't be able to help you. We are not allowed to give information about any of our patients without their consent. It is a matter of confidentiality. Okay. And then what you need to do is you need to offer solution for that as well. You have done it, you have refused him politely. So what you can do is you can tell the father that okay, you can visit her, or do you know where does she live? Why don't you check if she's in contact with other relatives? Do you know if she has some friends? Why don't you check on with them? Okay. And if he says he has done everything, then you can offer to contact his daughter. This would be the solution. Then if the father says that, okay, doctor, I have done everything and I have no clue, then you will be saying that, okay, what I can do you a favor. That is, would you like me to contact your daughter? And we would, after speaking to her, we can, after she gives consent, after speaking to her, we can inform you of her health. or we can inform you about your daughter. Would that be okay? Then you have to ask that, okay? And would you like me to contact your daughter? And then the patient, the relative might be, the father might be very happy. He would say, okay, daughter, uh, yes, doctor, please, you can contact him, you can contact my daughter, okay? And after that, you should also tell that, okay, after we have contacted her, if she couldn't be contacted within 48 hours, or if we couldn't contact her, we will also inform you in that case. So then you need to inform the police. You have to report to the police for missing person, okay? And then you have to give some general information like you gave in case of Emma. So you have to give some information here as well for reassurance that, okay, let me tell you that what how generally we handle patients with depression. That when people come to us with depression, we assess them, and we whenever we see they need medicine,